hold it. Okay, so thank you very much for joining us here. We have 4 carers in our room here in Parramatta, which we're very excited about. We know how challenging it can be as a carer to leave the home environment, leave the person that you're caring for, leave your other duties, of which you have myriad of other duties, and actually come along to a session like this. Megan and I, we both see a lot of value in these sessions in providing information, but also providing a safe space for peer-to-peer interaction so that you can learn from each other, because we know that you are the experts. And because I'd already done it, I forgot to actually introduce myself. My name is Lauren. I'm very excited that you're all here and that you're watching online. We're joined today by Arabella, a speech pathologist from Better Rehabilitation, who's going to be talking to us about strategies for managing the unique challenges that come along with caring for an individual with brain injury. Caring for an individual with brain injury does bring up a lot of challenges that don't arise necessarily if you're caring for an individual with intellectual disability or with a physical disability. Brain injury usually involves damage to the frontal lobe, which leads to executive functioning issues. So in that, we're talking about memory, motivation, planning, organisation, decision-making, and the challenges of supporting a person who does struggle with those things can be massive for our carers, and that's what we've been told, and so that's why we have put together and reached out to our experts, such as Arabella and her team at Better Rehabilitation, to talk to us about how to manage caring in that role when you're dealing with some of those executive functioning issues. One of the other things that Arabella is going to be talking about today is cognitive fatigue, which can be very challenging to understand as a person who doesn't have a brain injury, the absolute tiredness and mental fog that can come along with a brain injury, even 10, 20, 30, 40 years plus post-injury. We are very grateful that Arabella has donated her time to come along today to talk to us about this topic. We recognise that each of you in the room and watching at home are the expert in supporting the person that you look after, and the idea of this is to give you some extra tips and tricks and strategies in ways that you may be able to support the person you're caring for. When we have a question in the room, Arabella will repeat it before she answers it, and I will put forward to Arabella any of the questions that are arising in the communication in the chat box on YouTube. So please feel free to put them in. That's how we found out that the sound wasn't working to start with, so thank you. And I'll now pass you over to Arabella. So thank you very much.
Thanks, Lauren. Good morning, everyone, near and far. I'll do my little greeting again. It's really lovely to be here, and it's a real privilege to be able to, from one expert to another, chat about the unique challenges that do face our carer population in caring for brain injury. Yeah, no worries. So as I go through these slides, I think that you probably have some handouts. In Parramatta, we have the slides up here that we'll go through. If I'm looking down here, it's just because I'm controlling some things and looking at my notes. Don't want to miss anything for you. So we might just get started. So today, the title of this show is Strategies for Supporting a Loved One's Behaviour, Fatigue, Memory and Motivation. And just really want to acknowledge again that the carers are the experts. You know, I've been doing a speech pathology role and working with people with communication issues as a result of brain injury for a few years now, but I understand that many of you have been living with brain injury, you know, in your families, in your lives for much longer than that. And you know, it's not a one-size-fits-all solution, but I do hope that we can go through some tips and tricks today. So we're going to go a little bit through understanding brain injury, just get us all on the same page with some common symptoms. And then we'll have a chat about some strategies to support your loved ones. So behavioural strategies, you know, strategies to support them through fatigue, which can be so unpredictable, through memory and through motivation. So yes, you are the expert. You know the person best. I want to acknowledge the strengths that you have through practical, everyday challenges and implementing, your own things that work and don't work. I think that there's a lot of strength in relationship as well. For instance, a lot of our clients with brain injury will have those short-term memory problems, but those long-term memories can be a bit more intact, and again, depending from person to person. But the fact that you've been in their lives for a long time has a lot more weight, and there's a lot of value in that. It's important to understand what you know about the person, and what is important to them is going to be one of the key factors in helping them through their life's journey. And I just really hope that we can support you to take a strengths-based approach to supporting your loved ones. If you have clients with brain injury like myself, it pays to focus on their strengths. So, brain injury. And look, this is a slide of the brain. We know that there are lots of different areas of the brain. Lauren mentioned that the frontal lobe, which has quite a bit of impact when it comes to brain injury, really does focus on those memory problems, those executive functions. But we just acknowledge that there are other parts of the brain as well that have different functions and might impact your loved one differently. So, we have different lobes. We've got the parietal lobe, which is looking at language and touch. That's the one that I'm quite familiar with. We've got the occipital lobe, which is looking at vision. The cerebellum, we're looking at balance and coordination. The brainstem, those real reflex functions as well. And then the temporal lobe. So we've got, lots of different areas of the brain. Depending on what a person's injury is, they're obviously going to have different problems. So again, it's not a one size fits all, but there are some really common symptoms that we see with brain injury. You would be even more familiar with these than I am. So there are physical changes. We do get reduced coordination. There's some weakness or paralysis, reduced balance, physical fatigue, and sensitivity to light and noise. So those sensory changes. Lauren beautifully said that you have unique experiences with brain injury that are different to intellectual disability, different to physical disability, but we know that those things can actually still co-occur. So sometimes you can be dealing with all of it at once, and that's what makes brain injury so unique. Those cognitive changes, so the short attention span, the flitting from topic to topic that we see, some confusion, loss of memory, word finding difficulties, difficulty learning new skills, difficulty planning, and those rigid thinking patterns. So again, you would be more familiar with these in your everyday lives, and I'm sure that this is kind of bringing up some things that you've noticed and that you know about the person that you support. Sensory changes, so changes in smell, taste, speech, hearing, sight, and behavioural changes obviously are a big issue. Those that impulsivity, the impatience, that sense of a short fuse, the problems with anger, and just that emotional regulation, knowing how to process those emotions, knowing how to represent them in a really functional way, just becomes impaired. Low motivation is something that we'll be talking about this morning, and apathy, the sense that, I don't really care about much and nothing really interests me, and, tied in really nicely with motivation. Some social changes, reduced social skills, difficulty maintaining relationships and establishing new ones. And I know from my experience with people with brain injury that that's something that we work on a lot, is those social skills and how to reintroduce yourself and how to, do those really practical functional things that people might just struggle with in the planning or into just judging the appropriateness of what they're saying. Those emotional changes, loss of self-esteem, sadness and grief, depression and anxiety, which obviously comes from any kind of grief in life, any kind of grief or loss, and the irritability and the short fuse that we talked about. So now that, a really brief overview of the symptoms, because again, you guys are the experts, you're the ones who know, but let's have a chat about supporting the symptoms now. So those common behavioural symptoms, the verbal aggression, the physical aggression sometimes. So inappropriate shouting and threats and language, the pushing and hitting, sometimes inappropriate sexual behaviour just because of that lack of inhibition that really is helped out by the intact frontal lobe. Those repetitive behaviours, repetitive questions to do with the lack of memory, wandering around, inappropriate social behaviour, and a lot of risk-taking behaviour, which can scare us quite a bit, because it's often that risk-taking sometimes that got us into the situation in the first place. So it is frightening. And the reduced drive or the difficulty initiating activities, people staying in bed all day, very difficult to prompt them to complete tasks. This happens for a number of reasons, and the amount of control that someone has over their behaviour varies. Some behaviour, no matter who they are with, or where they are, will be apparent, but some others can push through and really kind of modify their own behaviours around other people. But when it comes back to the home, and when they come back to the people that they're most familiar with, you see a different side, because it is so difficult to manage that behaviour, takes such a mental load, such a cognitive load, that you're the people that they can really take it out on, or come back and just rest with and relax with, and maybe not regulate themselves as much. So there are those environmental factors, and there's personal factors as well. Stress and worry and frustration and depression can really, I guess, impact the behaviours that someone experiences. And again, you would know more than me that it just is it fluctuates. It can be unpredictable. Sometimes there are predictable environmental factors. There might be triggers, people or places, or things that you need to do, parts of the routine that might trigger. But then again, you might have really, really good days where things seem to be going quite well, and again, fluctuates. It changes a lot. Medication, also a big factor. So obviously, medication can contribute to good things, but it can also have those side effects. And fatigue being a big one of those. And we'll have a chat about that today as well. So we're going to just talk about 5 principles for positive behaviour. Supporting structure and routines and consistency, adding positives and seeking assistance. So as I go through this presentation and we talk about fatigue, we talk about motivation, we talk about the topics, we're going to address them with these 5 principles. So supporting rather than fixing. You've got to keep in mind that the person, even if they understand the impact of their behaviour, often it's out of their control. Yeah, and there's not a lot that we can do to fix it, but we can support them with positive behaviour strategies. And I think it's important to note that it's the people who are living and working and constantly alongside the people with brain injury who are going to have the most impact. As occupational therapists and speech pathologists and psychologists, we can come in and we can consult and liaise, and we can do face-to-face therapy, but it's not necessarily going to create that generalization, that change across environments that we want to see. And so it is a huge role, and we just acknowledge that it's a massive role to support someone, knowing that the fixing option is often not there. Supporting them with structure and routine, we're really compensating for the part of the brain that's been damaged, often that frontal lobe. We've got a lot of impacts in the front of the brain when it's bounced back. And so that frontal lobe damage leads to those difficulties with problem solving and planning. So to assist someone by having a structure, having some consistency, having that routine, as we all know that's such a trigger word for us, is routine. It's compensating for that part of the brain that can't do it itself. So by externalizing the structures, as opposed to we hold them internally, but by making them external for someone with brain injury, we can help them to support their positive behaviours. Consistency, and this is consistency with all stakeholders, whether you're caring for someone at home or whether you're caring for them as part of a team with, supported independent living or specific disability accommodation, all these this NDIS world where we have a lot more support now than we would have access to before. Maintaining consistency across the stakeholders is, again, going to make sure that we have more meaningful change on the outside to support and compensate what's lacking on the inside. Adding positives. So the outcomes are always better when we implement strengths-based and focus on the positives. I think a lot of this presentation is about adjusting our expectations and acknowledging that what might be a normal goal for someone without brain injury is an epic mammoth goal for someone with a brain injury. And so by being realistic with ourselves and with the person with brain injury and focusing on the positives, which might seem like you're a one-person cheer squad at some times, but again, by having that consistency, celebrating those small positive steps, it supports behaviour change, and there's a lot of evidence to suggest that. Finally, seeking assistance. It's, the carer's mantra is you can't care for someone if you're not cared for, yeah? So seeking assistance, getting help from, if it's a professional in a certain area, speech pathologist to help with communication because you're not quite sure what to do, or whether it's a psychologist, getting allied health services involved. Also, people at Synapse, the amazing work that they do here and the amazing experience that they have with many different clients, never hesitate to ask, yeah? And that, I think, encouraging the person with brain injury to also ask for assistance and to ask for that help, which can sometimes be that embarrassing factor, sometimes can be seen as a barrier to independence. If we're modelling that ourselves and seeking help, then again, positive behaviour change, the people that we support can seek help, and it can become less of a one-person cheer squad. Okay. So, some specific strategies, keeping in mind those 5 strategies to support someone. Looking at physical aggression, and we'll go through these quite quickly. I'm going to read them out. I'd love you to reflect on your experiences. We'll have some time at the end to share stories and I guess discuss tips and what has worked and what hasn't worked for individual circumstances. But I'm glad that you have these on your slides, your printouts, because these will be really good to refer back to, okay? So physical aggression. Lashing out in frustration when someone's not able to access a desired item or activity. Just an example, a support strategy, using our support techniques, establishing constant routines so that the person knows when to expect a certain activity or item in this case, and supporting them to communicate how they're feeling and facilitate problem solving. So that can all look a little bit wish-washy on a page, but again, when it comes to specific examples, we'll be able to chat through those and have a chance to really flesh that out and what it looks like. Socially inappropriate behaviour. So for example, difficulty picking the right topics when you're talking with new acquaintances, oversharing, those kinds of things. A support strategy, focusing on the positives, so providing positive praise when the person engages in appropriate conversations. So noticing, and again, what might be small for someone with out brain injury might be quite large and quite a big deal for someone without brain injury, and it's acknowledging those small things, providing that praise. Preparing them to understand what's expected of upcoming interactions. So for example, we're about to go to a birthday party. You can ask Sally about what types of presents that she asked for or that she wanted to get. So preparing someone, giving them that external structure to compensate for that internal structure that has been damaged. Sexually inappropriate behaviour, for example, kissing and hugging unfamiliar people, which can, be very confronting for us as, watching the people that we care for do these kinds of things. Support strategy, explaining types of physical behaviours that are appropriate depending on the type of relationship. Again, externalising those things that used to be intuitive, providing external supports. Saying, when you greet strangers, you can wave or you can high five, okay? To farewell family, you can offer a hug. Putting those structures in place and asking others to demonstrate appropriate behaviours for people. Seeking assistance, getting others involved, getting there to be some consistency. If people are hugging and kissing in a SIL accommodation in disability accommodation, trying to get some routine and consistency about what the behaviours that are happening there. Behaviours consistent across, all of the contexts is going to help someone to, again, move what's in that short term across into more of a long-term memory and really help them to solidify positive behaviours. So take-home messages when we're talking about behavioural strategies and those really functional everyday things that we might worry about. Staying calm when you're communicating with a person with an acquired brain injury, and maintaining a peaceful but not stressful environment. And how hard is that sometimes? Oh my goodness. When there's no peace or no calm coming at you, to maintain calm can be the most difficult thing. And I think that when we talk about fatigue a little bit later, and fatigue in our clients and our loved ones, the strategies that we talk about to manage fatigue are also really important to apply to ourselves. Yeah, carer fatigue is one of the biggest things that we have to deal with as professionals when we're working with someone with brain injury. You guys are at the top of our priority list, because you're the ones who are going to be making that meaningful change with someone and implementing all these different strategies and doing all these different things for them. So as much as you can, managing your fatigue so that we can maintain that peaceful and not stressful environment for someone. Understanding the reasons for their behaviour and working with them to minimise triggers. So again, if it's a predictable behaviour and you know that it's predictable, understanding that the sequence of events that might lead to a behaviour will help you to support positive behaviours, because you get to externalise that structure that they don't have on the inside. Drawing on routines to establish consistency across the day or across the week, depending on what your loved one's needs are. By using those consistent routines and consistent across circumstances. And we'll talk about having your loved one or the person that you care for have a lot of choice and control in those routines, and how much of an impact that makes to their well-being and their adherence to the routines and their behaviours is going to make a big difference. Supporting their independence. In general, their independence is your independence. Yeah. So when they can do things by themselves, you can back off a little bit. And so in any way that we can, by supporting their independence, we allow them the opportunity to ask for our help rather than anticipating their needs. So again, if we're asking for help from other people, we should be encouraging them to ask for help from us, and not just anticipating that this is our role, this is what I've been doing for a number of years, you can't do this by yourself. Let's see if we can introduce some give and take. If you need my help, you can ask for it. Okay. With me so far? Yeah. Okay. So, yeah, beautiful, good. I'm glad we're got some technological consistency. All right, we're going to have a chat about fatigue. So, fatigue is a personal experience, and it's so subjective. And I think that that's what can make it so difficult to manage, because you never know just from looking on the outside how someone feels on the inside. And that goes for all of us. We put a brave face on, we get through what we need to get through, but we might feel just absolutely tired, run down, exhausted on the inside. Other people might not be able to tell. It's a really subjective experience. Talk about symptoms of fatigue. That overwhelming tiredness, the exhaustion, lacking energy, being unable to motivate yourself. Forgetfulness can be a really huge factor when it comes to fatigue. And I even know personally that when I'm tired, that I'll forget things that people have said to me a couple of minutes before, and that has a huge impact on my day-to-day life. And you just can't imagine what it would be like to be living with that in a constant kind of capacity. The irritability, the slurred speech, and that dizziness. So everything is exacerbated by fatigue. Yeah, all of the problem behaviours that we see, the behaviours that concern us so much, are impacted by fatigue. So it just affects basically what we think, how we feel, and what we do. Everything, everything about us. Factors contributing to fatigue can involve anxiety and depression, sleep difficulties, medication side effects like we talked about a little bit before, reduced stamina, so not as much capacity in the first place. Pain can be a huge contributing factor, and I know that people with brain injury live with a lot of pain that can be very chronic and very difficult to manage. Physical and cognitive difficulties, so just being unable to do something that you could do before, and that the effort that it takes to exert, to just do a daily activity might actually cause that fatigue. The impaired sensation can cause fatigue. Diet can cause fatigue. Life stage changes, so these things can reappear when we come into transitions in life. Social roles, again, going out into the community and presenting yourself in one way, that in itself can cause fatigue. And the environment that you're in. Yeah, no worries. So, strategies to work on fatigue, pacing the day. For example, if you have a regular routine set up and you're pacing the day out, we want to always strike a balance between not doing nothing and not doing too much. And that can be a really fine tightrope to walk, because we want to avoid fatigue because it's debilitating, but we also want to avoid that, the sense of having no occupation, nothing that you're doing. So allowing for regular rest breaks and building those into routines, planning time and being organised, and understanding that fatigue can change things at the last minute as well. So having plans and being organised, yes, is really important, but making those plans flexible and having options available to yourself and to the person with brain injury is really important. Prioritising completing important activities first before fatigue sets in. And identifying what those important activities are, I suppose. So strategies to maintain fatigue, continuing sleep hygiene, so establishing a regular bedtime routine, having a sleep ritual, so reducing screen time is something that there's a lot of emphasis on at the moment, but making sure that that's not really serving to keep you awake and to make your body think that it's daytime. Creating a calming bedroom that's cool, dark and quiet, so again, those environmental factors, using relaxation techniques together, avoiding naps after 4 p.m. can be really important to establish some good sleep routines, and not exercising within 3 hours of going to bed. As much as we can get tired after exercising, it's actually pumping those energized hormones through our body. We're thinking we need to get up and do something, and it's going to be quite hard to rest after that. Nutrition and hydration, so food factors, obviously diet being an impact. Fatigue can be impacted by changes in diet or suboptimal nutrition and hydration. Referring to a dietitian is, I know that not something that might be very common with people with brain injury, but dietitians are experts in the way that the body functions on food. And so they can assess whether the intake matches the daily energy needs. For example, if you're not eating enough, or if you're eating too much of the wrong thing, something that's not going to give you the right kind of energy. We will see those ads with the slow release energy, and that's really what we want for people with brain injury, because it's going to minimize the impact of fatigue. But considering the foods that your loved one eats, and considering whether a referral to a dietitian, even just to get some strategies, might be a good idea. Looking at medication reviews, so if there are side effects of the medications that include fatigue, then just discussing it with the doctor can be a really good step in trying to manage the impact of medication on fatigue. Environmental modifications, so again, like the bedroom, we would modify to be a really nice calming space. Any workspaces that your loved one has or the person that you care for has, organising them to promote ease of access. So making sure that they have what they need in front of them. It doesn't take a million cognitive processes to actually find things and to get things done. But if things are laid out and organised in front of them, it would be worth it. Good lighting to prevent eye strain, which can impact fatigue. Use of labels and signs, again, externalizing the structure that we would have on the inside. So to help them find things more easily. Preventing interruptions from others by using signs to say, I'm working, I'm focused, that can help to communicate to other people without them having to find out for themselves the impact of bringing someone out of one world of focus and into another. That interruption in routine, again, that can be quite damaging. And reducing background noise is always a very helpful idea. So the take-home messages from, I guess, fatigue. as I said, it's also very important for carers to think about their own fatigue. And I just wanted to flag that before we talk about these take-home strategies. Carer fatigue is something that you can just come to live with and come to accept, especially if you've been in this role for a long time. But there are strategies that you can implement, that you can use for yourself to take the load off your brain and to support yourself with a more structured and more external, you know, routine and environment, just so that you don't have to feel like you're coordinating two lives at once, which we often are, you know, and getting a bit more structure in place. Always asking the people who support you for if there are supports that you don't know about, if there are things that that you've been doing, and just even going over your routine with a support coordinator or an expert in the area can really help to identify little things that might make a little difference. And if we have a lot of little things making a lot of little difference, it can equate to quite a big difference in the day-to-day. So again, I think that there's a lot of evidence when we've had feedback from carers about what works to manage fatigue, and the call card is work around it, not through it. Yeah. So knowing that fatigue can change your plans last minute, anticipating that fatigue could be an impacting factor in your plans, working around it from the start means that you don't have to work through it when it comes. So maintaining those reasonable expectations again, and I guess that's the core of why we would plan breaks, why we would plan rests, and why we would modify the environment, because we know that fatigue in this context is something that is, again, unpredictable and can be really great one day, and capitalizing on the great days, you know, really seizing those moments to go out and do something that's refreshing together can help to build those positive aspects back into that relationship, which can often be strained as a result of a caring and cared for relationship. Again, remaining flexible in your planning. If you don't achieve the activity, trying to reschedule it for a different time, and trying to do things that are really financially flexible as well. So if there are things that, you know, can't be cancelled, and there are things that, you know, they're very inflexible, trying to work around those and seeing who you can contact, who can advocate for you to say, look, this is actually a big impact in my life and in my cared for person's life. Is there some agreement that we can come to, or are there stipulations? So again, just getting that advocacy for yourself and spreading the word as well about how brain injury can impact the day-to-day, which will make life a bit more accessible for us all. And then just acknowledging that the person might not be able to do as much as they did previously. Yeah, it's the reality, isn't it? And it's a really difficult reality, but acknowledging that with them and saying, you know what, this is hard for you, but you're doing it well. Acknowledging and praising those small steps are so important. But the key message there is to work around it. And that will help us to avoid working through it, because I think that's when, again, a lot of those other behaviours might present themselves. Memory. Let's have a quick chat about memory. It can sometimes feel like you're fighting a losing battle with memory. And I think that the way that routines and fatigue and memory all work together, you can think, okay, well, I have a great routine and it's set up, but, you know, the person I care for can't remember the conversation we had this morning about what today's going to be like. And that can present a real problem when it interacts with all the rest of the symptoms as well. So symptoms of memory problems, obviously forgetting people's names, forgetting words, losing a train of thought, which can be so frustrating, getting lost at the shops when you're out in the community, repeating or forgetting past conversations, misplacing things, and a difficulty learning new skills. So especially, and that, again, that brings us back to those life transitions where I'm no longer working, I'm retiring, or I'm no longer living at home, I'm moving into supported accommodation, or I'm getting carers to come in and help me. Those new skills and those new routines that you might want to really establish can be very difficult to learn with those memory problems. And there are lots of reasons why this can happen. You know, the memory isn't just in the one place in the brain, and it's not just one kind of ability. There are so many structures in the brain that are involved with memory, and so therefore lots of different kinds of memory. We've got our long-term memory, our short-term memory, our prospective memory, and the memory of the injury as well, which can be, often at the forefront or not even there. So it's again, no one size fits all, but when there is a brain injury, you know that there is going to be impact to memory. The small bony protrusions inside the skull will get right to where memory is held everywhere. And so it's just going to impact people, some people more than others. So again, you're the experts of the people that you care for. You might know how memory impacts them, but the extent of the injury really does determine the extent of the memory damage. Strategies for memory problems. Using external memory aids. And again, a lot of what we're talking about is externalizing structures that you and I have internally. Using things like tape recorders, using things like the functions on a smartphone to set alarms and to have calendars, post-it notes, flowcharts for reminders, and planning and decision making, and memory books can all be things that help with memory. Again, we'll have a chat afterwards about your experiences with people with memory issues and what works and what doesn't for you. Environmental strategies, again, keeping a really nice ordered environment, having a home for everything. And the more consistent that can be, then again, the more that can move across into that long-term memory space. Color coding things, avoiding clutter, and designating places for objects are all going to help with memory, but also that sense of fatigue, the visual fatigue that you might get from having to process all of these things at once. Having a routine, keeping notepads beside the phone or at the front door or wherever someone might need to jot something down, and tying objects to places. So again, having a home for everything is going to help move things into that long-term memory space. So memory strategies, take-home messages, being patient. Memory difficulties are frustrating for everyone involved. And we all have them from time to time. And I think even just on the very, very mild level that we as typical human beings have them, walking down the street and someone walking right up to you and you going, I know who you are, but I actually don't know your name. And the embarrassment and the shame that can cause, even just in that, for something small and insignificant like that, can be, it can change the rest of your day. It can really change how you feel about yourself. So just understanding that and empathizing and being patient can make a really big difference. And it can, again, help the person that you care for to ask for assistance, okay? So if you can create a comfortable environment for them to say, I don't remember and I need some help, then that can, again, focus on the positives. You can build that relationship and you can really help them with their positive behaviors. Not taking it personally, again, the person hasn't intentionally forgotten, but trying to give reminders in the lead up to an important date, for example, a wedding anniversary, a birthday, something that you want them to remember, supporting them to remember that, giving them reminders helps them avoid embarrassment, but also helps you, focus on the positives again and really create that structure outside of the brain. Using visual aids to support the individual's independence. So simple tasks that you might be doing for them because you need to explain it over and over and over again and they can't remember how to do these tasks. Externalizing those tasks, putting a visual structure in place, breaking things down step by step into little tasks might help with their sense of independence, might help with your sense of independence as a carer, and will, again, capitalize on something that we know works for people with brain injury, those visuals, those external aids. And again, creating consistency in routines and order in the environment. These things take so much time. It's repetition and encouragement. And it's like Lauren said, these things can come up years and years and years and continue for years and years and years. But by creating that consistency and routine, by externalizing structure as much as you can, then it's going to help the person that you support. I might just take a sip of my water. While we talk about motivation. So, motivation. Let's talk about the common symptoms of difficulties with motivation. So they might have difficulty making plans or following through on plans. Difficulty knowing where to start with something can really impact motivation. Experiencing a loss of interest and enjoyment of previously enjoyed interests and activities. So things that you once were really passionate about. Again, that apathy has come into play and it's linked in with that motivation. You don't want to or need to do it anymore. And a reluctance to engage in activities suggested by others. Sometimes it can feel like really talking to a brick wall when you're trying to throw out suggestions and say, hey, you used to really like this, and why don't you come with me and do this, and why don't we do this? It might be fun, but that real reluctance that I just don't want to get out of bed. And we see how these things all interact with fatigue, with cognitive problems, with memory. They all work together. And so these, the strategies that we chat about should all be really worked together and used. And that's why asking for help is such an important thing, so that you can get some tips and tricks on those. I think that personally, for myself, the ability to just get something done is a really rewarding and it's just a really rewarding experience. Even if it's just a little thing, we love ticking things off to-do lists. We feel a sense of satisfaction when we've got our jobs done for the today. And I think that's something that the people that we support miss out on quite a bit, that sense of accomplishment and achievement, which is a bit of a vicious cycle, isn't it? Because it can be very demotivating to then go, well, I guess I should do something, but I don't feel like it because I don't ever get that sense of achievement. And so I never want to do anything. And it doesn't end unless we really break it. And that can be so difficult. And again, it's dependent on other factors around the place and the different things that are involved. And again, you might have really different functions for someone with brain injury. So you might have someone who physically can't shower themselves, physically can't get dressed in the morning, and physically, can't put together their own breakfast. And motivation for someone in that situation is going to look so different to someone who can physically do those things, but requires a heck of a lot of prompting from us to get there. So it's going to look different for everyone. And again, I think that when we have a chat through your experiences and talking through the strategies that we can that have worked and that haven't worked amongst the group, we can have a nice, insightful conversation. So strategies for reduced drive and initiation, focusing on the positives. So activities that are meaningful, and not just meaningful to us, but meaningful to the person with brain injury, are what we want to focus on. If they don't have a lot of motivation and they are prone to fatigue and all of those kinds of things, then planning less desirable activities that are necessary, things like personal hygiene and diet, alongside something that is interesting and enjoyable, and identifying those things that are interesting and enjoyable to someone now, which we understand might have changed. It's about being a bit adventurous and trying to figure out, what's outside of my life and what's outside of my realm that I don't actually have information or access to. How can I get support from other people to give me ideas as to what might be interesting. Keeping photos for reference on things that they enjoyed pre or post injury to motivate interests and to maintain that interest and motivation. So again, externalizing that memory. If someone has said, I don't really enjoy anything, but for a fact that they enjoyed, going to XYZ last week, taking a photo of that, having that photo accessible, and that's, proof to the contrary, really, and saying, actually, there are some things that you do enjoy. You haven't smiled in a while. We're going to go and do this because I'd love to see that beautiful smile again. Identifying barriers to engage in activities of interest. So reduce independence, navigating the community due to changes in memory, wanting to be with someone else, if there's a particular person that they actually want to do tasks with, breaking down those big tasks, again, those mammoth tasks, like navigating in the community, into those smaller steps, and promoting that independence in that area can be a really motivating factor for someone. especially when the people that we work with don't have a lot of independence. I find that there's even less motivation there. And so by building independence, you can often build motivation, but it's about adjusting our expectations. And I feel like I'm repeating myself, but it's just all these things work together really closely. Offering choice. So collaborating with the person that you care for to identify a range of ideas, and having consistency in the way that the choice is presented. A nice tip when you're working with someone and you're giving them choices is to give them an either or choice as opposed to a yes or no choice. So, we're going to clean up now. Would you like to wash or dry the dishes? It's an either or. It's not, would you like to come and help me wash up? Because they can just say flat out no. But you can't say no to a question that's, can you wash or can you dry? Which one are you going to do? And giving them an opportunity to rediscover or explore. Okay, so engaging in activities that were of interest or activities that they have never done before. Okay, and again, that takes help. It takes support to identify things, because we can say, I'm out of ideas. I don't even know anymore what might interest you, what might create that kind of spark that gets things going. But that's where we need to ask for help. And again, asking for help from other people will really assist in our own independence. So we do want to avoid that task avoidance that comes by saying no. So asking those either or questions can help quite a bit. So the take-home message is, the more you can encourage someone to own their routine, then the more they know what's expected of them, because they've set it up for themselves. And once you do have that set up routine, keeping it consistent, making sure that it's across environments, and making sure that you're doing it on a daily basis. Focusing on finding personally motivating activities. If you've run out of ideas, ask someone else, because there's always something else that we can do that might, it might be the last thing, and it probably will be the last thing that you would have thought of trying, but that might actually, strike a nerve with them, so to speak. And offering a range of options which they may accept or decline. And I suppose that either or tip can be quite useful. It does take a lot of encouragement, and it is about setting realistic expectations. We would love for the people that we care for to live independent and typical lives, and what is typical to them is going to be very different to what's typical for us. So setting those realistic expectations and having a lot of encouragement, but having the know-how to break tasks down and celebrating little steps. Again, it can feel like you're a one-person cheer squad, but by bringing other people into the mix and saying, this is what we're working on, this is the goal, for you to be independent of me, or for you to be independent in this area, and this is what we want you to be able to do. Those small steps can really help get there. The occupational deprivation, I think, which is that sense of having nothing to do and doing nothing, can be a real rut to get out of, and can be very, very difficult to really bump someone back onto the road and say, hey, yep, let's keep going. So just, again, rewarding things that are mundane with things that are exciting, and going over the top, and reaching out for help and asking for different ideas, that's the really take-home message when it comes to motivation. So just come to the point in the presentation where I'd love to hear from anyone, either on the chat or in the room here, with what are some of the challenges that you've faced when it comes to motivation, fatigue, memory? How does it impact? So what's the actual functional impact of it on your life, or the life of the person that you care for, or both? And what has worked and what hasn't worked? Because I think that the more tips and tricks that we can share amongst ourselves from lived experience and real life examples, the better we can support each other in settings like this, and the more meaningful settings like this can become. So is anyone out there happy to, put it out there in the ether, what your experiences have been with any of those things? Yeah. Yeah. So it's been useful. Yeah. Yeah. Are there things in there that you've tried before?
Not really. Never really had anybody tell us this is
Yeah.
how you do it.
Yeah.
Don't you
Yeah.
get what is it frustrating?
Yeah. So a lot of new information. And yeah, I think knowledge is power, isn't it? And knowing these kinds of things and having an idea of what you could try um, can can when you're at the crossroads between frustration and peace, it can take you down a different path because you can feel a little bit more empowered to try something new. Has anyone else tried some of the things in that? Yeah.
Let's start by identifying the fact that our part of our whole life
Yeah.
came to us over 2 months possibly. We've identified it as not an injury, and we've also divided up for so that's basically coming from a lot of information we don't have simply the Department of Human Services not protected services, and only now we've got to be part of using it as a legal right. So yeah, which means we get so we can work on that basis. How important is it to know what the let's say just we know the corpus personal damage and so forth. Okay, we know that something has happened, we don't know what, we don't know the circumstances behind the complexity you have this phenomenon. So I find some of the things he has probably written how to work with him, who would be appropriate specialist paramedical to work with this phenomenon is difficult because I see him implementing a great deal of OT and a great deal of speech. Is it, and they need to work together, and they need to, it almost needs to be the same person, or if you're working together with a very close team, so that he can get what he needs out of it, and we can make that progress. I would say physically, we've got some of the time like bit of what an outcome. He has clearly serious speech difficulties, really poor coordination, and we go all of those things. And it's just a lot of money. Who do you go to get this coordinated?
The coordinated care.
Yeah.
Yeah. So we've got a someone here who cares for someone with brain injury, and it sounds very complex with fetal drug and alcohol syndrome mixed with intentional brain injury, and not knowing a lot of the history because it's come out of a foster sort of environment. Now 25 years old and kind of discovering all of the complexities that have previously been unknown. And it's about, you know, this gentleman has said that all of the symptoms that we went through are really everything that describes his son. And it's about knowing who to go to for help and having a coordinated approach to care where you're not working with professionals who are giving you conflicting advice or you're going over the same information with 10 times and trying to explain the complexity of, but working with someone who belongs to a team of professionals where you can have a really coordinated approach to care. And it's very difficult to identify who those professionals should be according with what the symptoms and what the difficulties are. Speech, obviously we have a look at communication, but what is communication? Communication comes into play across all these different things. And if I can't communicate my functional needs to you, then is it about an OT, identifying what someone's functional needs are, or is it about a speech pathologist working to communicate the functional needs? And that can be really difficult. And I know that there are lots of organisations out there that work in teams as speech pathologists, occupational therapists, physiotherapists. Our team, that's certainly the way that we've structured things because we identify that that's the way it needs to work to support families. And if you're saying that you need a lot of OT and a lot of speech to overcome certain things or to even just put structures in place so that it's a little bit less dependent, so that someone that you care for is a little bit less dependent and can take more of that independence on, then yeah, absolutely finding a team that works for you is the most important thing. Yes, and I think that's where I know that Synapse does an amazing job of coordinating supports and linking you in with people who have that strong, not only a strong multidisciplinary team culture, but a strong knowledge of brain injury and how that differs from autism and cerebral palsy and all the other disabilities that the NDIS still services. Always ask, if you're saying, I don't actually know where this fits, ask someone else, they might know. Ask the professionals themselves, and grill them. That's absolutely right. I think that the fact that you're the experts in the people that you care for. So you need to know that you have a team that's going to be on the same page as you with what your knowledge is, and being able to share your knowledge with other people, but get them to bring some trained expertise to the table as well.
Some of his symptoms are outside into the role of an ADHD, for example, inability to cross over.
Yeah, proprioception, yeah.
If it's out of sight, you can't handle it.
Yeah.
So you can't even brush your hair for God's sake.
Yeah.
And the internet's a brilliant place, but incredibly confusing.
It's a rabbit hole, isn't it?
But I'm just saying, one classic example I'll share. We have someone working on how to do the brushing. And it's about the crossing out. You do the left hand side quite easily because you've got hand. That's fine. But to do the right hand side is nearly impossible. I met somewhere, some organisation in the States dealing with things like that. On that, just get in front of the mirror, put his hand on the side, brush it through. It works.
Yeah.
Move the right hand side to the left hand side.
Yeah.
Perfect.
Yeah.
It's a strategy which works. It's not a solution. It's not a fix.
Again, yeah, and so the strategy that this gentleman has been talking about is the issue with the corpus callosum and the that part of the brain where you have nerves communicating from one side of the brain with the other side of the brain, and the difficulties that can come with things like crossing over. And the example is brushing your teeth, and how his son, who is left-handed, can brush his teeth on the left side, but crossing over to the right side is very, very difficult. He's found a strategy that works, which is it turning your head? Turn your head in front of the mirror so that visual information can actually be the only thing that person is seeing. And it worked to cross over. Yeah, it worked really nicely. But it's about finding that information and sourcing it in the first place, and trying a billion different things before you get to that point where you go, oh, this has clicked and this has worked, which is why it's so important to share in things like that, in situations like this, I think, because obviously, I didn't know that. I'm not an OT, but I, that's an amazing strategy that if it works for you, it will work for someone else. Yeah, beautiful. Yeah.
I think one of the other parts of the question, Arabella, was also around how important is it to know the exact nature of the injury. If you don't have a diagnosis, and you don't understand what happened, how it happened, and what its effect is, are the strategies then just stopgap measures? Was that what you were asking?
Yeah, and I think a good functional assessment and a good multidisciplinary assessment looks at a person's presentation. Obviously, background knowledge is very useful because there are things that we might be able to infer from background knowledge, but I think that when we're actually dealing with someone's functional presentation and what they can and can't do and what's important to them, those are the things that we target. And so you don't need a scan to understand what someone has trouble with in their day-to-day and what someone finds important. And I think that to me, when I'm dealing with, a scan is really useful to think about before the assessment and see, this is what I might see, but when it gets to the assessment, all I'm thinking about is, what have I seen? What has someone else described that maybe is different to what I've seen? Trusting that you're the expert, how can I work all of that in to what is actually, again, what the functional impact is in this person's day-to-day life? Because we live in a functional world, and the NDIS is very function-driven, and it's less about being able to grip something just for the sake of gripping it, and it's more about being able to grip a toothbrush for the sake of brushing your teeth. So we're looking at function. The nature of the impact isn't as important as seeing that person face to face, getting into their environment, understanding their function.
Thank you. That's really interesting. And to be honest, that's probably somewhat different to what I was expecting, which is, I'm not a trained speech pathologist or occupational therapist. So it's great to know that whilst a diagnosis is helpful and it's certainly required to get help under the NDIS or my aged care, or diagnoses always help to access the support once you've got it. When the speech pathologist comes in or the occupational therapist comes in, the help that they provide is based on their assessments of the functional impact of the condition or conditions that the individual has. I am keeping an eye on any of the chats. So if you do have questions, please do get in touch. Some of the things that I wanted to comment on, Arabella, was I saw the way it hit the room when you said something about being a one-person cheer squad. I think that's something that, and perhaps it is a two-person cheer squad for some of the people in our room, but the feeling of isolation as a carer and being the person to have their loved ones back, often making a lot of decisions and implementing a lot of strategies on your own, perhaps with or without the understanding of your own wider support network. That's something that I hear a lot in my communications with carers, and I think that it's important that we acknowledge that some of our carers are one-person cheer squads, and we wish that weren't the case. And the idea through these sessions and through some of our other programs is to provide carers with the opportunity to access support from other people in the same position, because sharing your story and sharing your understanding of what it's like being a one-person or a two-person cheer squad can give you a sense of belonging. And perhaps it's not going to help with absolutely everything that you do. We acknowledge that. One of the other things that Arabella said that really hit me was it might just be a little thing that makes a little difference. But if you have a couple or a lot of little things that each make a little difference, that can make a big difference to you and to the person that you're caring for. One of the other things that I noticed, Arabella, in the discussion was how some of the strategies for one of the areas that you're talking about, so for fatigue, for example, or motivation, coincided with or correlated really well with some of the other areas. So, you were saying for decision making, offering an either or choice rather than a yes or a no. But that strategy, you said, also worked for memory because it provided consistency and routine in the way you were delivering a question, which helped place the responses and the decisions in that longer term memory. So that was really, really noticeable.
And I think it's all about those, the core support strategies that we have. And I think they were on the first or the second slide that we actually started the presentation with. But going through those strategies and seeing how you can creatively approach an area of concern for you or a behaviour by looking at support, by looking at externalizing things, by looking at consistency and routines, by aiming to praise little things, by being realistic. Those things apply to everything. And I think that the more you can internalize those things, the easier that picking new strategies will be.
So what you were referring to then, Arabella, was those 5 principles. Yes. Which we did share and we have gone across. So it was supporting, providing structure and routine, consistency, adding or seeking the positives, and seeking assistance. Seeking assistance is really, really important for carers, for your own well-being as well as the person that you're caring for. I do a lot of talking as always. So were there any other comments or questions or things that you've tried or that you're not sure how to try? Anyone in the room or online?
Talking about the exact same thing about talking over the circle. How I support that program. Guess what?
So again, just as how something so simple can make such a difference. And I think again, the issue of crossing over and that issue with the corpus callosum, with the nerves communicating with different sides of the brain. You know, swapping the knife and fork around on the plate in front of your son has really helped him get the fork to his mouth. Yeah, and I think it's again, even though these tips seem, so some of them may not be relevant to your personal circumstance, but the more that we share those little tips and the little successes, the more overall success we have as a group. And I think that there's a lot to learn from just the little things that work. And they might have been things that you've been doing for years, but there is one part of, you know, the person that you care for, their routine, one part that just they always get right or they always find some success with. And if you can share that with other people, and even if it doesn't serve to do anything but just get it out there and to celebrate, you know, your own sense of pride and joy, it can actually be picked up by a lot of other people, and it might just be something that they haven't tried before. We all have things that we haven't tried. You know, we might be at the end of our rope, but there's more invisible rope. There are more things. So I think it's about the more we talk to each other, the more rope we get. Yeah.
Arabella, when we started this program, Synapse Carers, we reached out to the people who we already knew were the experts. We reached out to carers. We reached out to other people as well. But Megan and I ourselves, as the project lead to this, we're not carers of individuals with brain injury, and we knew that you are the experts. By living it, by breathing it, by participating in it, by having breakdowns and then coming back, you have these tips and tricks. And so when we put together these information sessions, we were told by our carers that you wanted to hear from carers. So we've done our best to have more than half of these information sessions delivered by carers of individuals with brain injury. Not today, but over half of our information sessions are being delivered by carers. But the other part that we were told is that you wanted to learn, not from me necessarily or from other experts, although everything you've said today is absolutely wonderful, but you wanted to learn from each other. So having a carer here talk to us about the tricks that they've had, and hopefully you can think, oh, I might try that. And, you know, there were some things that Arabella said today that I think would be relevant for some of the other individuals who are being cared for from the people in the room. Arabella mentioned tips for motivation around proving that that person has enjoyed something before. Well, you might not feel like going out and doing this, but I know that you enjoyed it because you are here. We've got a photo of you doing it last week. And what about if we did it together and we could have a go and see how that works? Just those little things might make a big difference in motivating the individuals that you're caring for. Yeah. We've just had one of the members in our audience here describe a passion that the person she's caring for used to have watching a movie that he's lost the interest in. And so rather than having attempted to say, why don't you watch a movie instead of doing that other activity? Why don't you do this? Which wasn't working. This carer has actually just made it a bit more of an enjoyable activity that they could do together. So come on, why don't we pick a movie? Let's sit down together and watch it, and we'll make it even more fun by adding popcorn and things like that. Finding little ways to increase motivation, which also goes along with these 5 principles, in that you're supporting, you're praising. Oh no, you did have it actually up there. And you're actually building the relationship and the rapport between the two of you, which is hopefully going to lead to more positive behaviour happening over time. Were there any other questions or comments? I'm just checking all my myriad devices to make sure I'm not missing out on something that someone has sent in. No? Okay. question we've got in the room is about fatigue, probably cognitive and physical fatigue, with the individual not wanting to get out of bed in the morning. And this gentleman lives in supported independent living, so he does have carers coming in who attempt to wake him up, and he says no, because that, or he just doesn't wake. That's his the way he's communicating. And so I think, Arabella, it's more about what are some strategies for the carer in supporting the individual to get out of bed, but also in encouraging the other people who are involved in this instance, the paid carers.
Yeah, absolutely. So he's moved out of home into supported independent living. So what worked to get him out of bed when he was at home? Mum? Yeah. 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 Yeah, you've had your 5 minutes. Yeah. Yeah, and I think so the strategy that was used at home when mum was waking him up was, a mum's forceful rip the covers off after 5 more minutes, which was the request. Yeah, and I think when we're talking about the strategies that we've discussed today and having consistency across environments, it's especially hard when you have different carers coming in and waking you up, and that there's a different set of circumstances now that you're living in. And I think trying to initially, because it's the early stages, he's been in for 4 months, did you say? About 6 months? Yeah, the year's flying. But in those early stages, and we can see that those transitions in life can be a time where we just really see it regress. I think that as much support to maintain that consistency from the old routine into the new routine is a really good thing. So if your son has a phone and if he's expected to, yeah, 57 times. Okay, so phone calls have not worked. And what about phone calls while the carer is actually there? Yeah. Yeah. Okay. And so the carers, sorry, having to repeat. So the carers come in, wake him up. If he doesn't wake up, they just move on. Yeah. So do you see that as being part of the caring role, the actually motivating and getting him out of bed for the day? Yeah. Yeah, absolutely. So yes, the idea is that that is a carer's role. That is the role that you were doing that you expect them now to take on. And I think it's about advocating for that within his new environment, because that is a routine that worked before. And saying this consistency is what's going to enable him to have a better quality of life. If he sleeps all day, and you said sometimes he just sleeps for 24 hours, if he is sleeping all day, then obviously other areas of his life are going to rapidly decline, which we absolutely don't want, and which is not the point of SIL. So, getting as many advocates behind you as you possibly can to say, this is our routine, this is how we stick to it, this is what my son needs. I think it's the hard word on the carers to say this is the expectation.
On the paid carers.
Yes, on the paid carers, yes. Yeah.
And it gets louder, and it gets louder. As I say, we should like have a good progressive stop. It's not cheap. It's basically and it just gets louder and louder and louder.
So what we've got happening in here is some really good quality sharing of tips and tricks and informations around an alarm clock. So we might end the live presentation. There haven't been any questions coming through, so just in case I have missed it, I do apologise, but I haven't received any questions online. So thank you for watching and for your time. Arabella, thank you so much for coming in and sharing your wisdom. It's been wonderful, and the feedback that I've had through people sending me messages is that it's been a really engaging presentation, lots of information, lots of take-home messages. And I certainly saw a lot of people in the audience scrambling down notes. That's always a good sign.
Yeah.
So thank you so much, Arabella, and thank you to Better Rehabilitation.
If there are any questions, please feel free to reach out to us through Lauren, or go on our website. You can call us up, and if you had questions about the presentation, get in contact with me. I'm very happy to send that around.
Wonderful. Well, thank you very much. We'll close this and hope you all enjoy a cup of tea and some morning tea now. Thank you.